Manubriosternal fusion and the detection of possible associated parameters.
Thank you so much, dear Chairman and colleagues. I am NUR HÜRSOY and attending from Turkey, and I am so delighted to take this opportunity to present my study to you about Manubriosternal fusion. Why did I choose this topic? Actually, it's an interesting topic for me because I am studying on thoracic imaging, musculoskeletal imaging, and also breast imaging. And the common point of these three main areas is sternum. Additionally, we all know that this small flat bone is associated with the thoracic shape. Its location is so important for the shape of chest wall. And the pectus carinatum and excavatum are two examples for this association. And they are the most common deformities of the anterior chest wall. Secondly, the variations of the sternum are commonly seen by radiologists on chest CTs or even X-ray. And in my daily routine practice, I have noticed that one of them, the complete Manubriosternal fusion, is so common in my population, and so I have decided to plan a study about it. I have chosen 200 patients randomly and examined the sagittal and coronal planes for the complete Manubriosternal fusion. And after all, the control group was selected with the similar age and gender, and I have approved the statistical tests. I've added some extra measurements to investigate the main effect of the Manubriosternal fusion to the thoracic shape, and these three images demonstrate how I measured this. And I measured Heller index, sternal and vertebral angle, and again sternal angle in which patient has Manubriosternal fusion. We know sternal angle or Lewis angle is the angle between the axes of manubrium and the corpus of sternum. And results, the percentage of Manubriosternal fusion is 70%, and there was no difference between age, gender, and Heller index and vertebral angle. However, the sternal angle was significantly higher in fusion group. Same results with tables, and we can see that, interestingly, even the young patients with younger than 40 age, we can see Manubriosternal fusion, and on contrary, the older ages, we can still detect that Manubriosternal joint is open. And as I mentioned before, sternal angle is significantly higher the fusion group. Discussion, as I expected, the Manubriosternal fusion is more common than literature. And interestingly, there are some few studies from Turkey, and our results are similar. So I think that in Turkish people, Manubriosternal fusion rates higher than the other some countries. I couldn't find any explanation about this in literature. I examined the methods of this study. Maybe this difference may depends on the population, the selected population, but it's not. The selected populations is also similar. So maybe some genetical factors may play a role, but still I don't know why is difference. And the other significant result of my study is about the sternal angle, and this fact means that if Manubriosternal fusion occurs, the sternum becomes more vertical and its shape change. of course, the main question is, does this variation affect the lung capacity or the anterior chest wall movement during inspiration or expiration? I hope that further studies will help us to find correct answers. And conclusion, I want to repeat that there is no disease but the patient, and the term of variation is one of the proof of this famous aphorism. If only we radiologists be careful about the presence and the clinical relevance of variations, so the clinicians can have a chance for a detailed evaluation of the patient. And I think that not only the radiomics, radiogenomics, or biological or environmental factors, but also variations must be an essential component of precisional medicine. And as Stephen Covey says, strength lies in differences. And I want to add this part, we must recognize and define them. Some of my references. And even our heart is full of sorrow because of the earthquake in our country. It's a great pleasure to being here. And thank you so much for your attention. Shukran.
Thank you, Dr. Noor. Any question? Okay, we have finishing our session, and we will wait for the next session. Okay, thank you.